You know, it's kind of wild when you think about it. Even the words we use for something like a bed sore, they've changed quite a bit.
Hmm.
We used to say pressure ulcers, but now you hear pressure injury a lot more.
Yeah.
Okay, let's maybe unpack that because that change is not just about words, is it? It feels like it points to something deeper, like how we understand these wounds now.
Exactly. And this deep dive today, it takes us right into that whole evolution.
Yeah.
Everything we're talking about, it comes from this one source,
Yeah.
the fifth edition of Wound Care Essentials,
Mm.
Practice Principles
Right.
by Sharon Baranoski and Elizabeth Ayello. It's, a real cornerstone text in wound care. We're basically exploring some of the biggest takeaways from it.
And it's not like we're looking at ancient history here. This edition, the fifth one, it came out in 2020.
Yeah, 2020.
Which, as the authors point out, that was a pretty significant year, wasn't it? The year of the nurse.
And Florence Nightingale's bicentennial.
Right. So that timing kind of highlights how all these new ideas, they're built on a really long tradition of care.
Absolutely. And wound care,
Yeah.
it might seem, super specific, but honestly, it touches so many lives, directly or indirectly.
True.
So whether you're in healthcare or maybe you're a caregiver or maybe you're just like interested in how health stuff works, getting a handle on these principles is actually really valuable. And this book, it lays it all out.
Okay. So it's a big book, a comprehensive resource. Where should we start? Maybe let's circle back to that first point you made, the terminology shift.
Yeah.
From pressure ulcer to pressure injury. What's the actual thinking there?
So what's interesting is the why behind that change. It seems subtle, but it's important. Ulcer, traditionally, it sort of implies the skin breaking down because of like an internal disease process.
Okay.
But injury, that word captures the fact that these things can also happen because of outside forces, mechanical forces.
Like pressure or shear.
Exactly. Pressure shear. So it broadens the picture, right? It's not just about the patient's condition, but also what's happening to them from the outside.
Ah, that makes sense. It's like acknowledging the environment, the external stuff plays a huge role, not just what's going on inside the body.
Precisely.
And speaking of the bigger picture, the book mentions these key groups, these organizations that are sort of shaping the standards, right?
It does, yeah. It really emphasizes the work of groups like the National Pressure Injury Advisory Panel, the NPIAP.
NPIAP, got it.
They focus on research, education, preventing these injuries.
Mm-hmm.
Then there's the European group, EPUAP,
Okay.
and the Pan-Pacific Pressure Injury Alliance, PPPIA. These big international groups, they
So
collaborate.
it's a global effort.
Totally.
Yeah.
And that led to the third edition of the International Pressure Injury Clinical Practice Guideline that came out in November 2019, just before this book edition. It really shows a global consensus on the best approach.
Okay, so the language is changing, the guidelines are getting updated with the latest thinking. What about like the day-to-day practice, how wounds are actually cared for? Big shifts there too.
Oh, definitely. I mean, one of the huge changes the book talks about is just the move to electronic medical records,
Right,
EMRs.
right. Pretty much everywhere in the U.S. now.
Yeah, replacing all that paper documentation. And that's fundamentally changed how people communicate, how they access information, collect data. It's more efficient, opens up possibilities for research too.
It's almost hard to imagine going back to paper charts. But the book also tackles something I think a lot of people have heard, that old rule, turn every 2 hours to prevent pressure injuries. Is that still the gold standard?
Yeah, that's a really interesting point it raises. The book gets into the evidence around repositioning and how it's evolving.
Okay.
So that 2-hour schedule, it was the standard for a long, long time. But newer research, especially from Dr. Nancy Bergstrom's team,
Mm-hmm.
it suggests that if patients are on the right kind of mattress, the support surface is designed to spread out the pressure.
Yeah, the specialized ones, right.
Then longer times between turns, maybe even 4 hours, might be okay. It definitely challenges that old turn every 2 hours mantra.
Wow, okay. That is a big shift. So it's not just how often, but also what the patient is lying on.
Exactly.
The surface matters.
And I bet technology is playing a bigger part here too, helping with this.
Absolutely. The book highlights how support surfaces and beds are getting way more sophisticated, engineered to manage pressure better. And we're also seeing things like wearable devices now that can track a patient's movement.
Oh, really?
Yeah, and they can alert staff if someone hasn't shifted position in a while. So technology is definitely becoming a bigger tool for prevention.
Like a little proactive nudge? That's
Yeah.
clever. The book also mentions a type of injury I hadn't really thought much about before, injuries caused by medical devices themselves.
Yes, that's a really significant development mentioned. The increased focus on medical device-related pressure injuries. or MRPI, and mucosal injuries, too. As we use more tech, more devices that touch the skin, the mucous membranes, those contact points can become spots for pressure and, well, injury.
That makes total sense when you think about it, like tubes or masks. Exactly. And it's becoming such a recognized issue that the updated Braden QD scale, which is a risk assessment tool for kids, it now specifically includes medical devices as a risk factor to check for. That really highlights how important this area has become.
Right. So we're seeing changes in definitions, prevention, tracking. What about how people actually learn about wound care? Has the education side kept up?
Definitely. The book points to a trend towards, like, shorter, more frequent learning sections. Bite-sized learning almost.
Easier to digest.
Yeah, maybe more manageable, more impactful. And obviously, online learning, distance education, that's huge now.
Makes it accessible globally.
Right. Wound care knowledge can reach way more people. And the style is changing too. More interactive, lots of case studies, real-world scenarios.
More practical.
Exactly. And a bigger focus on the whole team working together into professional collaboration. Because good wound care needs that coordinated approach.
Sounds way better than just sitting through lectures. And I think you mentioned the book itself uses some of these ideas.
It does. They've included these show what you know questions right in the chapters.
Oh, cool.
And there's an expanded wound gallery, more pictures, more examples, great for reinforcing the learning and having practical references.
Nice. Okay, let's switch gears slightly. The book talks about surgery, specifically minimally invasive surgery. The prediction was fewer big incision wounds, right, that pan out.
Yeah, that's a really interesting point it makes. Minimally invasive approaches and, the use of robots in surgery.
Right, robotics.
They have led to smaller cuts, and patients often go home sooner.
Okay, so what's the ripple effect on wound care then?
Well, that's the question it poses, kind of. It might shift the type of wound care needed, maybe fewer really large incisions to manage, but you still have to be super careful with those smaller ones. And there's the possibility of, like, deeper tissue injuries that aren't obvious right away.
Okay, so the focus changes, but the need for careful management doesn't just vanish.
Exactly. Still need that vigilance.
And, of course, dressings. Can't talk wound care without dressings. Any big leaps forward there?
Oh, yeah, definitely. One really welcome change is dressings with gentler adhesives.
Oh, that's huge for patients. Less painful removal.
Massively. Much better comfort.
Yeah.
And we're also seeing these clever dressings that let clinicians sort of peek at the wound without taking the whole thing off.
Oh, wow. Like a little window?
Kind of. It minimizes disturbing the healing process.
Yeah.
Really beneficial.
That sounds great. But the book makes the point, dressings aren't the whole story, right?
Absolutely not.
Yeah.
It really stresses that dressings are just one piece of the puzzle, a holistic approach. Meaning nutrition is critical. Using antiseptics correctly, sometimes systemic antibiotics are needed. You got to look at everything influencing healing.
Makes sense. It's the whole picture. Beyond dressings, what other tech is helping clinicians? Assessing wounds, monitoring treatment?
Well, technology is really pushing things forward there. Remember the prediction about handheld scanners for stage 1 pressure injuries?
Yeah.
Well, portable ultrasound technology is basically making that a reality now for assessment.
Wow.
And there are new devices, too, that can actually give visual feedback on blood flow in a wound after hyperbaric oxygen therapy, HBOT.
Okay, explain HBOT quickly.
Sure, it's breathing pure oxygen in a pressurized room. Helps healing. This device lets clinicians see if blood flow is improving post-treatment. More objective data.
That visual feedback must be incredibly useful for deciding next steps.
Definitely helps guide treatment. And the book also mentions using infrared thermography. Low-cost versions.
Infrared, like heat sensing.
Yeah, basically. It's being used for early detection of things like Charcot foot or spotting wound infections early in diabetic foot ulcers.
How?
By picking up tiny temperature changes on the skin. Subtle signs of inflammation or infection underneath. Non-invasive, too.
Amazing. Just adding layers of information. So looking ahead, where does the book see wound care going? What's on the horizon?
It points to some really exciting stuff in tissue engineering. Things like stem cells, maybe gene therapy, to help wounds close, help tissue regrow.
Wow, okay. That sounds very futuristic.
It is. Stem cell-based skin engineering, gene recombination. These are talked about as potential future tools, cutting-edge stuff.
But I guess that's where breakthroughs come from. Any other future trends mentioned?
Well, the fundamental hope, obviously, is better prevention.
Yeah.
Just reducing the number of wounds in the first place.
Always the best outcome.
Right. And the book expects we'll see even more non-invasive assessment tools, getting more precise, earlier detection. And there's this ongoing wish in the field for technology to finally sort out the documentation burden.
The paperwork or screen work now?
Exactly, like maybe voice-activated systems,
Hmm.
badges that clinicians wear that just automatically chart things. That's still kind of the dream.
Oh, that would be a game changer for clinicians. Free up so much time. And the book also mentions the bigger system stuff.
It does, yeah. The authors make the point that public policy, how care gets paid for reimbursement models, that stuff continues to really shape how wound care is delivered, where, how, who provides it. The economics are always a factor.
Yeah, can't ignore the realities of the healthcare system.
Yeah. So, okay, we've talked terminology, guidelines, tech, future possibilities, quite a journey. But amidst all this change, what's the constant? What stays the same?
That's such a crucial point to end on, really. Despite all the incredible advancements, the book brings it back to the core. Wound care is about caring for the person, the individual who's living with that skin issue, that wound, that human connection, focusing on their well-being that has to remain central. Always.
And they included a quote, didn't they, from Florence Nightingale?
We did. Her message about courage, peace, perseverance, the importance of just continuous effort in caring for people, it's just as relevant now.
Yeah.
And the authors also give a really warm welcome to the newcomers in the field, and a big thank you to all the experienced pros for their dedication. It's a nice touch. It's a powerful reminder, isn't it? That even with all the gadgets and science, empathy, and seeing the whole patient, that's the foundation.
Absolutely.
So if we had to boil down the key takeaways from this deep dive into wound care essentials, what stands out most for you?
Okay. I'd say first, just that evolution in understanding, the shift from ulcer to injury, really seeing the bigger picture. Second, how practice changes based on evidence, like the repositioning timing. Yeah. Research really does refine to what we do.
Right.
And third, probably the increasing role of technology for assessment, for treatment, but always, always remembering it's about the patient's needs and comfort first.
Yeah. It's been genuinely fascinating to see how much this one field has evolved just based on this one book. Really makes you appreciate how dynamic healthcare is overall.
It really does. And maybe it leaves you, the listener, with something to think about too. As technology keeps racing forward in healthcare, how do we make sure we keep that balance? Using all the amazing innovation, but never losing that essential human connection in how we care for each other.
That's a really important question to ponder. A great place to leave it. Thanks so much for joining me on this deep dive today.